This bill is a deal with the devil. President Trump, you're either being lied to or you are lying to the American people. Because this bill represents, in the text of this bill, the largest and greatest loss of health care in American history. 17 million Americans will lose their health care on this bill, not undocumented people, not quote unquote the disgusting term illegal, but 17 million Americans will have their health care cut from this bill.
17 million Americans. That's not just a number. It's a nation-sized catastrophe waiting to happen. If Donald Trump gets his way and repeals the Affordable Care Act, that's how many people are projected to lose their health insurance. That's according to the nonpartisan Congressional Budget Office, an institution whose job is to remove emotion and politics from the facts. Let's watch further to see how disastrous this bill is for Americans. I'll be back at the end of the compilation with my thoughts on this.
On this point of tax on tips, as one of the only people in this body who has lived off of tips, I want to tell you a little bit about the scam of that tax, a little bit of the fine print there. The cap on that is $25,000. While you're jacking up taxes on people who make less than $50,000 across the United States, while taking away their SNAP, while taking away their Medicaid, while kicking them off of the ACA and their health care extensions. So if you're at home and you're living off tips, you do the math. Is that worth it to you? Losing all your health care, not able to feed your babies, not being able to put a diaper on their bottom in exchange for what? This bill is a deal with the devil. It explodes our national debt. It militarizes our entire economy, and it strips away health care and basic dignity of the American people. For what? To give Elon Musk a tax break and billionaires the greedy taking of our nation. We cannot stand for it, and we will not support it. You should be ashamed.
We are projecting deficits for the next 10 years of a minimum of $2.2 trillion. And I would argue that is a rosy scenario. And particularly when you take a look at what they've done with the One Big Beautiful Bill, they're not seriously reducing spending to what I've been calling for as a pre-pandemic level. I just want to put this in perspective. President Obama, over the course of his 8 years, his average deficit was $910 billion. CBO is projecting, and again, a rosy scenario, that we'll be averaging $2.2 trillion over the next 10 years. So we'll take our debt from $37 trillion up to $59 trillion. And if we extend the current tax law, take away $4 trillion in revenue, roughly, that add another $4 trillion. The spending cuts they're talking about, they're paltry. You know, 1.5 trillion. Some of those are fake. Some of those are extended way out. They're offset by
out?
10 years.
10 years.
Yeah, I mean, we'll spend the money up front for the border, for defense. So that also takes away from that 1.5 trillion in spending. So at most, we're maybe cutting spending 1.2 trillion.
So what you're saying, like the numbers you're describing are like the bottom line numbers. This is not like higher math. This should be obvious to everybody. What's the reaction been?
Well, they just ignore it.
Hey, Anthony.
Yeah.
Did you see that the budget bill passed?
Yes.
What do you think about that?
Well, a phrase that I keep hearing about the Trump administration's actions is that the cruelty is the point. And I think that this bill is a perfect example of that. It's a bill that claims to be helping poor people and low-income families by cutting taxes on their income, while in reality it's moving crucial benefits from those people in order to shift wealth to the ultra-rich.
Who's going to be impacted by this the most?
Low and middle-income households for sure. At biggest risk is anybody receiving Medicaid benefits. Nearly 1 in 7 current Medicaid beneficiaries could be losing those benefits because of new work requirements that are being imposed by the Trump administration. While the Republican Party likes to describe Medicaid beneficiaries as, lazy and unmotivated, the truth is that many of them are disabled and unable to work because of their disabilities. They might be veterans. A lot of them are elderly people. These are people that rather than being able to work to meet these benefits, may simply just die because they can't receive critical health care. We're also looking at potentially another 8 million people that could be losing access to food assistance through the form of SNAP benefits because of, again, work requirements that are being placed on those benefits. And many of those people are children. So we're using the lives of the disabled, of the elderly, of the poor, of children to fund tax cuts for the rich, increase military spending that is completely unnecessary, and to fund what's basically a terror campaign against immigrants in this country. And then on top of those lives that are threatened by the loss of benefits, there's a number of other terrible changes in the bill that are also likely to disproportionately affect poor people. Critical among them is cuts to the green energy industry that, when you combine them with the effects of recent executive orders, such as the removal of hurricane monitoring from public access, could lead to millions of lives being lost because of global warming incidents like hurricanes and tornadoes in the upcoming years. So we're really just using the lives of millions and millions and millions of poor Americans, many of which live in GOP states and may have even voted for the representatives that supported this bill, to further increase the wealth gap in this country. And the Republicans in Congress are laughing about it. Cruelty is the point.
What can people do to stop this?
I think the best thing going forward at this point is honestly a general strike. Unfortunately, I think the only party that's really capable of organizing a general strike is the Democratic leadership itself. Something like a general strike requires so much funding and organizational capacity that I don't really see any other organization, especially grassroots organization, able to do so. Whether the Democratic leadership has the will and resolve to do that, I don't know. But for the average person in the U.S., I think the best thing to do is to push your senators and representatives to call for a general strike at this point.
Hey, sorry your rural hospital shut down. We needed to send $160 billion extra dollars to ICE. 160 Benson Booney billions with a B. That's more than the annual military budget of every single country on the planet, besides us and China. And it's half of China's. Now, typically in a bit, you'd leave the funniest part for last. That has the highest escalation, but the U.S. is a silly place full of morons, so it's actually only like a fifth, maybe a sixth of our military budget. But it is triple the Marine Corps. You're telling me we need more ICE agents than Marines? Hey, you think when they're done kicking out all the people with too many vowels in their last names, they'll just hang up their hat? Mission accomplished. You guys can have the other 50 billion back. Pay no attention to the fact that the president said into a camera that he plans to get rid of citizens next, and that he directed the DOJ to start denaturalizing people. Just those pesky immigrants that the son and grandson and husband of immigrants Donald Trump just needs to get rid of. The man who seems to think that political asylum is the same as insane asylum. There's a $50 billion to the border wall. Remember when Mexico was going to pay for that? What a quaint lie. Another $50 billion to building more internment camps. You know, like the one that they're making merch for. Just a good Christian nation following the laws of Christ all the way to the line to buy merch from the internment camp. Just a little sign of the cross and a kiss to baby Jesus, who wipes away a beautiful white tear, looking down at elected officials in America, saying that the alligators eating people would be awesome, actually. Just ignore that the Pope sent a letter saying, like, hey, this is egregious what you're doing in this bill, taking all this health care and getting rid of all these immigrants. But that's the wrong kind of Christian. I don't care that his magic chair talks directly to God. Some king in the past wanted a divorce, and that's how I made my religion, so I don't have to listen to the Pope. Or maybe my religion came to be during a schism in 1845 because half of us didn't accept slavery, and the ones who did stayed down here and created our own religion. Yeah, go look it up. Entire religion based on we want to keep ours. States' rights! But it's okay to take all this money away from Medicaid to stop illegal immigrants who already couldn't access Medicaid from accessing Medicaid. Also, we can go find these dudes working for pennies on the dollar in the fields picking produce for Americans who can't be fucking bothered, so that we can kick them off to an internment camp selling merch, and then deport them to a country they're not from. For Christianity. For Jesus. And remember, when that produce is rotting in the fields and it takes 45 minutes for an ambulance to come to your house to drive you 2 hours to the nearest hospital just so your insurance premiums can be jacked through the roof, and all the... Remember, it's the Democrats' fault. You know, the ones who all voted no for this? The Republican Senate and Republican House of Representatives and Republican President putting forward and naming this the big beautiful bill, stealing trillions of dollars from our pockets to give to the richest people in the history of the world, and give $160 billion to one of our greatest modern shames. It was all the Democrats who stalled and voted no and put forth amendment after amendment after amendment to try and save these rural hospitals, and every single one was shot down. But it doesn't matter, because it'll be 3 to 4 years from now. And that means it's the Democrats' fault. Hip hip hooray! It feels good to be a veteran today.
Good afternoon. If you're seeing this video, that means the House passed the bill and it's going to Donald Trump's desk. The genius part of this whole plan is that most of the actions won't actually take effect until after the midterms, so Republicans don't have to run on a crappy campaign. But also a lot of them are going to take effect in 2028 during the new presidential election. So none of the effects of this bill will be able to be refuted during the election, if we still have elections. So I got my trusty iPad out because the only thing more dangerous than Donald Trump is a black woman with an iPad. And I just wanted to let a few people know about Medicaid. Now, I know people don't care about Medicaid. Not something that's really top of mind. But you know who does care about Medicaid? Low-income families, low-income seniors, children, people with disabilities, people in long-term care facilities. Yes. And I just wanted to give you guys a little list of every state that has Medicaid. You may not know it as Medicaid, though. And so if I mention your state and the name that is actually Medicaid, it's because it's different than straight Medicaid. Now, there are some states that call their state-ran low-income medical insurance Medicaid, so it matches with the federal government, like Alabama. Alabama calls their state-run medical insurance for lower-income families, lower-income seniors, all of that. They call it Medicaid. But if you're in Alaska, it's called Denali Care. If you're in Arizona, it's called Arizona Healthcare Cost Containment System, the AHCCCS. California, Medi-Cal. Colorado, Health First Colorado. Connecticut, Husky Health. Delaware, Diamond State Health Plan Plus. Florida, Statewide Medicaid Managed Care, SMMC. Hawaii, MediQuest. Illinois, Medical Assistance Program. Indiana, Hoosier HealthWise, Hoosier Health Connect. MED Works, Health Indiana Plan. HIP. Iowa, IA HealthLink. Kansas, CanCare Medical Assistance Program. Louisiana, Bayou Health, or Healthy Louisiana. Maine, Maine Care. Maryland, Medical Assistance. Massachusetts, Mass Health. Michigan, Medical Assistance or MA. Minnesota, Minnesota Care. Mississippi, Mississippi Can. Missouri, MO HealthNet. Nebraska, Access Nebraska, or Nebraska Medical Assistance Program. New Hampshire, Medical Assistance or NH Medicaid. New Jersey, NJ Family Care. New Mexico, Centennial Care. North Carolina, Division of Health Benefits. North Dakota Medicaid Expansion Program. Oklahoma, Sooner Care. Oregon, Oregon Health Plan. Pennsylvania, Medical Assistance. Rhode Island, RI Medical Assistance Program. South Carolina, Healthy Connections. Tennessee, TennCare. Texas, Star Plus. Vermont, Green Mountain Care. Virginia, Cardinal Care. Washington, Apple Health. Washington, D.C., Healthy Families. Wisconsin, Forward Health or Badger Care. And what's funny about this is that so many people from rural states did not care about Medicaid. But they might care about Sooner Care. They might care about Cardinal Care. They might care about Equity Plus. When you see these things happen in 2028 and your Meemaw and your Peepaw can't be covered in their long-term care facility and you have to come out of pocket for it, remember July 3rd, 2025. And what happened today? and how you voted for this. And the people that didn't vote for this, I'm so sorry. Our country is absolute trash. Garbage, if you will. But here we are. Happy Independence Day. Eve. Okay? All right. You guys have a good one.
Morning, how are you?
Go to hell.
How are you feeling this morning?
Go to hell.
You doing okay?
Go to hell.
Let's talk about what Trump won't say out loud. The Affordable Care Act, Obamacare, covers over 40 million Americans. It protects people with pre-existing conditions. It keeps costs down. It expanded Medicaid in 40 states. For many working families, it's the only reason they can see a doctor. And yet, Trump still calls it a disaster. He tried to kill it in 2017 and failed. Now he's back, promising to terminate it again without offering anything real to replace it. What does that mean for you? If you have a pre-existing condition like asthma, cancer, diabetes, you could lose coverage or be priced out. If you rely on Medicaid, especially in a red state, you could be cut off. If your hospital depends on that funding, it might shut down. This isn't healthcare reform, it's destruction, and it hits the sick, the elderly, the poor, and working class Americans the hardest. But it's not just healthcare. Trump's big, beautiful promises keep ending in disaster. His border wall didn't stop immigration, but it did separate kids from their parents. His tax cuts helped the rich and exploded the national debt. His climate policy ignored science and gave polluters a free pass. His foreign policy cozied up to dictators and left our allies in the dark. His law and order stance, it ended in chaos, scandal, and a Capitol riot. And now he wants to finish the job. But finish what? The destruction of our safety net? The divide and conquer strategy that leaves everyday Americans fighting for scraps while billionaires get richer? Here's the truth. The people who cheer Trump on are often the ones hurt most by his policies. Rural families, veterans, farmers, factory workers. Many don't even realize their health care comes from the very law he wants to destroy. No one should have to beg strangers online to afford chemo. No child should die because insulin costs too much. No grandparent should choose between medicine and rent. We're not too poor to care for each other. We're just too broken politically to act like we do. And Trump? He's not fixing the system. He's burning it down and calling it greatness.